Healthcare is confusing. Payer policies change, regulations are modified, reforms are proposed. We're breaking it down for you here on Inside Healthcare from Fulcrum Strategies. Today on the program,
I would use the individual market as a single risk pool. I would use the risk adjustment that's used to allay all the critical costs or catastrophic costs that go through the system. It's spread over many more people than it can happen to any one employer.
This is the Republican holy grail, what they want to try to do. It sounded like you started with making an impassioned plea for Obamacare, but you'd really like to do what Republicans would like to replace it with.
We would like to allow people to get subsidies where they need it.
Hello, everyone, and welcome to Inside Healthcare from Fulcrum Strategies. I'm Matthew Handley, along with our president and CEO, Ron Howrigon. Ron, hello.
Hello. Good morning. How are you?
I am doing very well. Finally, the government shutdown's over. Our last two episodes were on the government shutdown. And one of the things that was needed to get it passed was a promise on a vote on subsidies for the Affordable Care Act. Now, I believe, and you can correct me if I'm wrong, that the vote on the subsidies was only promised to the Senate, not necessarily promised in the House. And I know a lot of the discussion here is that the Democrats really didn't get anything out of their stalling for the shutdown. But we want to take some time today to talk about those subsidies, what they are, what their purpose is, and what might happen if they don't come into place. We're obviously already in that open enrollment period, so people are seeing different premiums than they had previously. But let's start with that, and then we're going to talk a little bit about Mark Bertolini, the CEO of Oscar Health, and one of his plans that he has put out there for trying to fix our healthcare system. But let's start with the subsidies, Ron. Yeah. Obviously, these were for the Affordable Care Act. They helped make those premiums a little bit more affordable. They're going away. They were sunsetting this year. Why was that? And how much money were people getting out of these subsidies to make their premiums more affordable?
Yeah, no, you're absolutely right. I mean, these subsidies are just that. They're designed to make premiums more affordable. And it's important to understand sort of who utilizes them for the most part. For the most part, there's a couple of groups of people that utilize them. First of all, are people who are working, but their employer, for whatever reason, doesn't offer insurance. Okay, so that could be small businesses, farmers, lower income people. But these are people working, paying taxes. They're going to have to buy their own insurance because their employer, for whatever reason, doesn't offer insurance. And this is an important and they make too much money to qualify for Medicaid. So these are working Americans, et cetera. These aren't people sitting on their couch eating bonbons. And they get these subsidies to help them afford their insurance. It's not a huge amount of money. In the grand scheme of things, the amount of money we're talking about here is about $35 billion a year. Now, those of us go, $35 billion, that's a lot. Well, that's less than 1% of the total healthcare spend in this country. It's about 0.7%. And it helps about 25 million people in the country. So it's not a huge amount of money. I mean, put in perspective, we gave $20 billion to Argentina, and I don't think anybody threw a fit. So it's designed to help individuals who otherwise probably couldn't afford insurance. It makes their premiums extremely affordable. And the removal of it is going to be crushing to a lot of people. I saw something the other day that especially the people who are sort of bridging to retirement, to Medicare, that somebody who is 60 years old and makes $65,000 a year is going to see their premium go up by about $1,000 a month. Okay. That's 20% of their total pre-tax income. That is unaffordable. And so we could have a bunch of people that, let's say, are 60, 62, 63 years old that are bare and don't have insurance. That's a really bad time to not have insurance.
Let's talk a little bit about what some of those plans look like, because I've peeked at some of these before just to see what was out there. Obviously, at the income level I'm at, I don't qualify for very many subsidies. But even so, some of these plans, they were almost, and I know there's a specific definition of this so that it doesn't qualify as this, but these looked like some of these catastrophic health plans where your deductible is $5,000 or $10,000. So,
and that's another important thing to understand. These people aren't getting like free health care. It's not like, I can have whatever I want to. Roughly 50% of the people that are getting these subsidies get their premium close to a zero. And people go, well, why should they get free healthcare? Well, a big chunk of that, let's say the bronze plans, by definition, only cover about 60% of all the healthcare expenses in that population. That means 40%, either through deductibles or coinsurance or copay, is paid by the consumer. So even if you're getting free insurance after the subsidy, you're still paying a fair amount of your healthcare cost. So bronze is roughly 60% covered. Yeah, as you go up, silver 70%, gold is 80%, platinum's 90%. And that's another thing that so people understand. Why do they get free healthcare? Well, it's not free. The premium's free, but they still have an awful lot they have to pay for.
It's not like it's not like some of these Medicare plans where the advantage plan where you don't have a deductible, you don't have a monthly premium. You still have to do that deductible, the copay, and all that.
Yep, exactly.
So I suppose the money then in Vegas is that there's not going to be a vote, or at least there'll probably be a vote in the Senate, but the money in Vegas is probably that there's not going to be any extension of these subsidies, at least this year.
Yeah, I think I would almost give any odds that there is going to be an extension of these subsidies. If there's a vote in the House, it will only happen if they know they have the votes to kill it. And I think there's better than even money. There won't even be a vote in the House. Because I don't think, and I, in some respects, and this is sort of that plague on both your houses, this is a political game. I as much as the Democrats will say we want to provide health care, this is probably more about the midterms, scoring political points. So they would love to have a vote so they could hang that vote around somebody's neck, which is why I don't think there's likely to be a vote in the House. But the idea that these subsidies will actually get expanded, no, I don't think so. I would bet any amount of money against that.
Let me ask this, because I know this is an objection that's come up among primarily conservatives, is that these subsidies were put in place around the COVID-19 era, and therefore they should be sunsetted because the pandemic's over. We're moving on from that. What's the response to that objection, and what kind of truth is there to that objection?
Well, it is true that that's when they came into place, was around COVID. And that's a legitimate argument. Now, my counter would be, well, the whole employer-sponsored healthcare came because of World War II. I mean, we have employer-paid health insurance because in World War II, there were wage controls, and it was the way to give people more money. Should we get rid of the whole employer? I mean, when World War II was done, should we have said, oh, hey, buy your own insurance? The reason of how we got here, to me, is less important of what happens if we take it away. What happens to going back up to 40 million uninsured people? What happens to our ERs? What happens to, the stress on the system and the hidden tax that employers are going to pay anyway? Because if you don't pay it through sort of federal subsidies, you're going to pay it through increased cost where hospitals are starting to get a bunch of care that they don't get compensated for. They got to get that money somewhere. So, yeah, it's right. It was COVID related, but to me, that's sort of a non-issue on whether we should keep it or not.
And we talked about some of those consequences in a previous episode of Inside Healthcare about what happens to those, especially the rural hospitals, if these subsidies go away. So I'll point people to that one as well. I want to transition a little bit, Ron, to talk about Mark Bertolini. He's the CEO of Oscar Health. He was on CNBC Squawk Box last week, talking about a little bit about the government shutdown, but also talking about his plan for reforming healthcare. And I'll start by saying that you can call me a cynic, but I'm a little bit skeptical when I see a CEO of a for-profit insurance company telling me that they've got a great plan to reform our healthcare system. And it's in part because they have a responsibility to their shareholders, and that any sort of reform that takes place, they're going to still need to be keeping their keep making sure their shareholders are making money. And Oscar Health is, like United and Cigna, is a publicly traded company. But he was on CNBC Squawk Box. He listed a couple of things he thinks needs to happen to, quote unquote, fix our healthcare system, including a consumer-driven healthcare marketplace. He also said a single healthcare marketplace for all of our for all fixes our healthcare, as well as an individual market which drives innovation and can revitalize our economy. And part of that, I think, what he's referring to, if I can sum it up, is that You need to have, we get rid of the employer based option where people are allowed to go out and buy their own insurance, either with an allowance from their employer or some sort of
Right.
allowance from the government. And we get rid of the state marketplaces and make it one federal marketplace.
Yep.
Doesn't sound too different from what some conservatives have talked about before. Of course, they've never put forward a plan to actually implement some
Mhm.
of this and have a vote on it. But let me start by asking you that, Ron, is a federal marketplace and a consumer-driven marketplace better than what we're seeing right now for, the kind of patchwork system that we do have?
Well, and I share some of your skepticism. The solution that Mark talked about, if that ever passed Congress, the stock price of his company that sells into that exact marketplace and only that marketplace would triple. So there is some, there's a healthy dose of skepticism on what his motivations are. Mark's an incredibly intelligent guy.
Mm-hmm.
He was former CEO at Aetna. He worked at Cigna when I worked at Cigna. So he's a really smart guy. So some of what he's talking about, I think, has merit. The problems that I have with his solutions are a couple. First of all, it's a bizarre product when you think about health insurance and the way it works for it to be an individual consumer decision. Okay. Because 5% of the people consume half of all the cost. Okay. For those people, they're absolutely, if you knew you're going to be in that, you're going to pick, the best benefits you have, et cetera. Okay. If you have MS, you're going to make sure that all the stuff there. But those people can never drive enough premium to come anywhere close to covering their cost. The only way health insurance works is to get the 25-year-old healthy male paying into a system that then pays for that person with MS or with, brittle diabetic, et cetera. But that 25-year-old male in that consumer market is going to pick the cheapest thing they can find with the narrowest network to get their premium down as much. So, and the other problem with healthcare, especially now, and we should have gotten rid of pre-existing condition exclusions, is, and then once you find out that you've got a cancer diagnosis, you're going to pick one of the better plans. So it's a little bit like knowing that you're going to have your house is going to burn down. Well, then I need fire insurance now. So the economics of it are very difficult at the individual consumer market without some sort of forced, mandated benefits or coverage. So that's my first problem with Mark's issue. The other problem has to do with, does any of this actually lower cost? It's the underlying cost that we have a problem with. I'm not sure that it does. I'm also not sure that people will be incredibly happy with, I picked a premium or a network that's really narrow, but then I turned out I need something and I don't have what I needed. I don't care whether this phenomenal oncology group is in the network because I don't have cancer. But what if I get cancer early in the year and they're not in my network? Now I want the best oncologist and I don't have access to them. So consumerism is extremely difficult to do at that level in healthcare. And again, Mark's solution would be great for Oscar and a few other companies. I'm just not sure it fixes our underlying problems.
Well, let me ask you a little bit about that actuarial science for a second, because that's his argument is that what you're describing is what we're seeing now in the state level marketplaces because they're too small to get the right balance of people. And he's arguing that if you put it into a federal marketplace, it's going to make it easier because now everyone's in the same bucket, as it were. Does that change your opinion at all, being a federal versus a state marketplace, just because of the volume of people?
Well, the law of large numbers helps. But I'll take our own specific area here.
Sure, yeah.
Because part of what he talks about is these narrow networks, and you'll pick the right network. Okay. Well, no one who is young and healthy is going to pick an expensive network and I'm just going to pick somebody that has Duke University Medical Center in it. They aren't.
Yep.
I don't care. Now, everybody who's sick is going to pick that until you need Duke and then you want it in your network. So what happens to those people who say, well, I don't really care about it until I care about it? And it's a reason why there are other insurances that have some mandates to it. It's a reason why if you drive a car, you have to have auto insurance, because otherwise you're going to say, I'm a safe driver, I'm not going to have an accident. It's a reason why you have to have other types of insurance. If you've got a mortgage, you've got to have homeowners insurance. You've got to. The problem with the actuarial stuff of what's happening in the state environments, I think, is more of the fact that They couldn't get done what they really wanted to get done in the ACA, which is to force pretty much everybody into it. The individual mandate's gone now, and the employer penalty was so low that that really didn't force people into the market. They still haven't figured out a way to make everybody play, which will spread the actuarial risk, whether it's state or federal, if there was a way that you could say everybody's got to play in the game here. Because everybody uses it, and when you use it and don't have insurance, it's you hurt everybody else. Yeah.
Well, anecdotally, to exactly your point, I did the same thing my first job out of college. I picked the cheapest HMO plan that was offered to me because I was generally healthy at the time.
Yeah.
Let's take Bertolini's plan a little bit and tweak it. Is it possible to tweak it in a way that makes it a little bit, in your mind, a little bit better by fixing, what is it? I mean, perhaps, you can't offer some of these narrow networks or something like that. Are there things that you could do to make his plan work and to make it a little bit more palatable for a business owner such as yourself, but then also as an economist looking at the system as a whole?
Yeah, I think so. And that's why I said, Bertolini's a smart guy, and there's some of the stuff that he's touching on that makes sense. This idea of having individual consumers choosing their insurance plan, I think makes a lot of sense. If they had money put into an account and you're working and they say, Matthew, you have X amount of dollars to buy a plan, and what's left over can help pay for out-of-pocket costs or whatever. Well, part of that would help solve some of the way that insurance companies treat people so badly. If you had a bad reputation, you might not get a lot of those young, healthy people. So some of that stuff is there. I think where it falls down is when you start to offer plans that are cheap, but really, don't have the necessary providers or only have don't have all the specialists, because then when you need it, it's not really there. So I think there would have to be some network adequacy mandates. I think there would have to be some benefit coverage mandates. If he gave an example of, well, if you're going to have a family, you'd have better obstetric care. Well, the problem is, it's sort of like the argument for property taxes paying for schools. If only people with young kids paid property tax for schools, that would be too much. That's why everybody has to pay for it. That's why everybody pays to have a fire department. My house has never caught fire, but I pay for, tax for a fire department. And if you let people say, well, I don't want to buy obstetric coverage, I'm not going to have a kid. Well, then the obstetric coverage becomes too expensive for those people who do need it. So again, there's some merit to this idea of having consumers pick. I just think the way he's talking about it is more beneficial to his company and doesn't solve enough of the problem.
Well, I will say, credit where credit's due. I was glad to see it was a plan from someone who's more business minded. One, it was a plan that was clearly thought out, but also it wasn't just give everyone an HSA.
Right.
Because that's what
and it's a great place to start. Throw something up and then have people, fix it or make it better. I mean, like I said, I was of that same mind. My God, here's an actual plan that has some detail to it. This is a good foundational start. Just like I'd love to see the Democrats come up with a plan. And how are you going to cover the cost? I mean, okay, it's all good to say we want to make sure healthcare everybody. How are you going to pay for it? Both of those political entities are sort of failing in those areas.
One last question before we go, Ron. I'm curious what you think of Mark Bertolini, being a former executive at some of the other plans, being the current Oscar CEO, but also being chairman of the board at Verizon Wireless.
Again, Mark is incredibly intelligent. I mean, I was in a meeting, this is years ago at Cigna, where the guy was doing long division in his head down to a decimal point on the fly. He catches things very quickly. He's a quick study. He can see sort of macro interactions. I mean, a really, really incredibly intelligent guy. So it's not surprising to me that he's chairman of the board of Verizon. It doesn't matter the industry. Guys with that kind of cerebral horsepower, can figure out business issues. The Oscar thing is really interesting to me, and I don't know why he chose it. Mark, had some issues with personal health and family issues. I sort of feels like, he got tired of the size of companies like an Aetna. He didn't leave that world because he couldn't do it. And I think he wanted to do something smaller. And so I think he's, playing at Oscar because it's not a behemoth. And the behemoth stuff frustrated him a little bit. But really bright guy. I'm not surprised all the Verizon, had him do that.
Well, Ron, that's about all the time we have for today. We'll be keeping track of his plan as well as any others that might come up. and we'll talk about it right here on Inside Healthcare. Ron, thanks.
Sounds good. Thank you.